funny story, maybe infamous story amongst the people I've worked with, and that was I was in a running contest. It wasn't to see how far you could run or how fast you could run. We were trying to see if we could run every day. And it started off with trying to run every day for a year. Well, by the time I got to 2018, it had been over 16 years of consecutive days of running. It was a little extreme after a certain point when you realize, 6,000 days in a row of consecutive running. And I noticed in early January of 2018 some left hamstring pain. So I kept running through it. What really hit me, though, that I had a problem was that I was taking athletes to the National Championship Series and then an athlete on to the national finals in Oregon. And I really couldn't walk more than 50 meters at a time. I was not suspecting any kind of back issues at this point because my back didn't hurt. It was all my leg and numbness in my leg. I was encouraged to get MRIs that revealed the herniated disc, and that's when I got connected with Dr. Demopolis.
I met Arthur here in the office, and I understood that from the beginning that he was a remarkable person. He was a very accomplished athlete and coach, and after I examined him, and I thought that he would be in a need for surgical intervention.
First appointment with Dr. Demopolis, I would describe as very reassuring. One of the things that stuck with me from that very first meeting was his real sincerity in stating that he wanted to treat me like I was a member of his own family. He made it very clear that you don't go into surgeries like this with your back lightly. I think his bedside manner in explaining things without being judgmental and providing a reassuring path forward really put me at ease.
Well, I enjoy taking care of my patients. I enjoy trying to see what is the unique way that the patient will benefit and improve their quality of life.
The folks that I worked with at Cornell really had wonderful things to say about Dr. Demopolis. So just in my own network, in my own community, I had heard really good things about the care here and the care that he provided. Whenever I've needed something, Cayuga Medical Center and the services that you all provide, I've always been able to get them. Couple that with meeting with Dr. Demopolis and feeling very reassured that he had the background to be successful.
I decided to be a neurosurgeon when I was serving in the Army, in the Greek Air Force. I was fortunate to be assigned in the neurosurgical department in the biggest hospital of the Greek Air Force in Athens. And I was fascinated by the impact that neurosurgery can have in the quality of life to the people that have a brain and spine disease. To become a neurosurgeon, I needed to have very good training, and at that time the best training in the world was in the United States.
My experience with the staff at CMC was terrific. They were really invested in my background and wanting to get me back up on my feet. My distinct memory is when I woke up and they first let me stand up, the relief, the pain relief was instantaneous and total.
In the past, we used to intervene in the spine through usually a large surgical exposure, but this came with a price in terms of the blood loss, the length of the recovery, the postoperative pain. With the minimally invasive techniques, we try to achieve the same goal of improving the quality of life and making the changes that are needed in the spine without completely altering the anatomy. Combine this with intraoperative navigation techniques that would allow precision and significant improvement on the surgical impact on the patient's health.
I was actually back running about 4 months, and this time when I started running again, I am no longer doing a daily running streak. I've learned the value of taking days off. The care that I received in Ithaca was world-class. Dr. Demopolis did a procedure that is complicated and is very advanced. It's a microdiscectomy, requires a lot of precision. He's a real expert, and I think we're very lucky in Ithaca to have somebody with that kind of expertise. At the same time, the thing I really appreciated was that there was real, warm, personal, individualized care. These folks were very invested in my return to the lifestyle that I enjoyed before then. So from the healthcare staff at the hospital, just wanting to know my name and get me through the journey, to what I still remember very vividly in that first meeting, Dr. Demopolis promising me that he would care for me like he would any member of his family. That's something that makes me feel good about this community, that we have that combination of world-class care and real personal, sincere devotion to the members of our community.